Welcome to our 5 on 5. We're pleased to be joined by Freddy Sennhauser, the Director of Communications for Allcare. Freddy, thanks for coming in. Appreciate it.
Thanks very much.
Our pleasure. So tell us, we're talking about, of course, CCOs, Coordinated Care Organizations. Is this Oregon Health Plan, does this have anything to do with the Affordable Care Act? Can I explain that for us?
I'm glad you asked me because it's the misconception we hear a lot. And at this juncture, it has not anything to do with it. It's really Oregon, a homegrown Oregon concept, of course, spearheaded by the governor, emergency room doctor by training and education. And really, it was really time to do something, to change it around a bit, to create these new providers that extend benefits to the Medicaid beneficiaries in Oregon.
Okay, and so you work for Allcare, which is a CCO, Coordinated Care Organization. What exactly is a CCO? To a layman, please.
To a layman, you could actually look at us as an insurance company, and we have a service area here in Jackson County, Josephine, and Curry County. We are a locally owned company. I represent 115 now newly empowered and energetic employees who can't wait to really transform the healthcare delivery system in Southern Oregon.
Okay, so why are we doing this? Why is Oregon taking these steps and doing something that is different, and why now? You know,
Oregon has always been a pioneer when it came to how we provide healthcare services to the Medicaid population. We've been doing this now under the umbrella of Oregon Health Plan for 17 plus years. But then 2 years ago, the state had, as we know, real fiscal restraints, had no money. They cut our reimbursements by 10%. And then last year, again, there was not enough money. The budget shortfall actually was $629 million. And you can't cut any more, because if you cut more, then the providers just can't, see folks anymore, or the patients. And so something had to be done, and what transformation in Oregon is really all about is to break down silos. In the past, we had these companies that did physical health, provided physical health, mental health, and dental health, and now with this transformation, bringing it all together in these coordinated care organizations, you make one company responsible with a global budget, assuming the risk and promising the state, for the amount of money we get from the state, to take care of the mental, physical, and dental health of all our members.
Okay. All right. Well, we've got a lot more to talk about. Obviously, we're going to take a quick break first, though, Freddy. Stay with us. We'll be right back. Welcome back to our 5 on 5. Again, we're here with Freddy Sennhauser from the Coordinated Care Organization, Allcare. So, Freddy, what is different now as we are in the midst of this change?
As I mentioned before, we had these silos, and now everything is under one roof. And one of the big things that has really changed is that we are now in a position to make those common sense decisions that we in the past couldn't do. In the past, we kind of would step over the line a bit. We were always afraid that we would commit Medicaid fraud. And now we are finally given the tools to make those decisions without fear of any retribution. And the governor uses this great example about this air conditioner. A heat wave is going through Oregon. There's this 92-year-old lady. It's really hot in her apartment. She develops congestive heart failure. She calls 911. The ambulance comes, takes her to the hospital emergency room. They stabilize her, treat her, keep her under observation for a few days, to the tune of about $50,000. And of course, we would have to pay that. And so the governor says, wouldn't it make more sense if we would have gone down to the local hardware store, bought a $200 air conditioner, installed it in her apartment, kept the temperature in her apartment at the comfortable level, and maybe avoided this event from happening? So there's $200 over here and $50,000 over here.
Yeah.
And so by doing something that's really good, if I get the money for a moment, just what's good for the member is for her not to have to go through this agony.
Of course.
And by doing that, it's good for the state, it's good for us, ultimately, as taxpayers, because we just saved $50,000. And in the past, we could never do this. Now we are empowered to do this. Of course, we're still kind of fine-tuning the rules.
Right, I would imagine, obviously we're talking hypothetically, but, getting air conditioners to all those people who need them is a difficult task.
Right, and you hit the nail on the head. So we have more than 28,500 members. We cannot afford to buy everybody an air conditioner. So you have to have some parameters, who now qualifies for this or that. And that's the good part about these flexible services, where we will empower our non-traditional healthcare workers to go do some home assessments, determine, in this case, it might be wise to purchase an air conditioner. Or in another case, we bought a lady, walking shoes because she couldn't afford them. But that was the only way for her to get moving. So those are the things that are completely new. And it really works under the idea of we have to provide the right care to our members at the right time, at the right place. And in this case, it's a non-medical solution. It makes so much sense, and it's so much more reasonable than what we've done in the past.
Okay, so what about ERs? I know we're trying to keep people out of the emergency room. How does that factor in?
Yeah, that's really one of the things that we have been able to really change. So we did a comparison of third quarter 2011 versus third quarter 2012, and we have reduced emergency room admits by 21%. And that doesn't mean that, we deny 21% of our members to emergency room care. That just means we redirected their care and really provided them other benefits or other providers so they didn't have to go to the emergency room. And of course, that is huge savings to the systems because emergency rooms are the most expensive place to get services.
Excellent. All right. Well, Freddie, thanks for coming by and answering some of these questions for us. Appreciate it. Pleasure to meet you. Stay with us. We'll be right back.